All right, so let's talk about something that is controversial that I call BS on, like literally BS. And I'm talking about IV vitamin therapy for pregnancy, prenatal IV and postnatal IV. Listen, morning sickness is not normal. Okay, morning sickness is not normal. All the people are telling you, yeah, it's okay to vomit and be sick and do all of the things. It is not normal. When you have morning sickness because you're deficient of something. All right. So I'm gonna use my story as an example. I give birth to my baby, Jaquel. She is 2.5 years old. And I have to tell you, I did prenatal IV the whole pregnancy. I did prenatal IV the whole pregnancy. I did not take any prenatal supplements at all. Okay. Baby came out fine. She's strong. I had a healthy pregnancy. I was so healthy that I returned back to work 2 weeks after giving birth. And I gave birth at the birthing center here in my hometown in the water. So we didn't go to the hospital. But I have to tell you what helped me because I have sickle cell anemia. We all have it. This is genetic. I was born with it. I have the gene and I have brothers that died from it. So therefore, anemia was a thing, right? I was at the beginning, as I was navigating this, listening to the doctors, the OBGYNs, the blah, 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 tell me you can do IVs. And I'm like, why not? Because if you look at it, it's me putting something that you can get from a prenatal pill into a bag. And I am going to receive 100% of it into my body. Okay. So to me, it makes sense. I'm like, it's B vitamins into a bag. It's folic acid into a bag. I just have, as long as I don't put things like the vitamins that are not for pregnancy, that are, going to create issue with, baby and mother, then I should be fine. So I did not listen to the OBGYNs. I didn't listen to the doctors. I didn't listen to anybody. I did prenatal IVs the whole 9 months. In the first trimester, I did a lot of it. And then as I'm moving forward and I'm increasing my caloric intake and I'm increasing my greens and I was doing my protein powder, like I did a lot of things because you have to have a special diet if you're pregnant, right? To give you that nutrients back. So then we get less, right? We did IV less. But if you are a pregnant person and you are experiencing morning sickness, or you are sick all the time, or this pregnancy is not going the way you want it to be, you need to replenish your cells. You need to give baby, the fetus, the embryo, whatever stage you're in, the nutrients that it needs for it to grow. And you also need nutrients, right? Because you are the vessel where carrying the baby, making sure the baby's safe, and making sure the baby come out right, making sure there's no adverse reactions, making sure there's no complications with the pregnancy. But I have to tell you, and if you're a doctor listening to this or watching this on our YouTube channel, thinking about anything else, like, that's a lie, this is dangerous, blah, blah, blah. I'm a firm believer, and I am a good example. And I also have mamas. I have a few pregnant mothers in my practice that got sent to me from Visiting Nurse Association because they know we do IVs here to help them navigate the pregnancy journey, to help them replenish so that they can stop throwing up, so they can keep the nutrients that they need to grow baby. Now, I am sharing my screen. So if you're watching this on IG or Facebook or listening to this on my podcast, you want to go over and look at the screen that I'm sharing because I have some receipts and I have some things to back up what I'm going to say. You can go over on our YouTube channel and look at the screen that I'm sharing. Of course, we have a lot of B vitamins. Again, everything that you can get from a prenatal, you can put in here. So, but when I make my bags, I don't make a lot of the prenatals. So I don't put calcium in here. I don't put any of that. I put magnesium. I put all the B vitamins. I don't put zinc. I don't put anything that I know for sure could endanger mom, could endanger baby. So I keep this very low, very simple. But the key ingredients that I put a lot of this in here is folic acid. You need folic acid. So I'm sharing, I'm looking at my screen, but I use not the synthetic one, I use the activated folic acid. So I'm sharing at my screen, so that's what I could find. Of course, you can get folic acid from the food. But again, if you're looking at food only, we're not getting the proper dosage, right? Because many of us, we don't have time to eat a lot of food. that's going to give you folic acid. We need to make sure we get this into our cells, into our body. So folic acid is not only it's good for pregnancy, but it's also good for anemia. It's also good for cognitive decline. It's also good for depression. If you want to prevent postpartum depression, get you some folic acid. It's also good for cancer. It's also good for vitiligo. It's also good for restless leg syndrome. It's good for gout. I'm looking at this. It's good for hypertension. Like this B vitamin, B9, is really, really good. You just have to make sure you get it into a methylated form. In IV vitamin therapy, you get 100% of every single dosage of folic acid. For my pregnant mamas, prenatal and postnatal IVs, we do a lot of folic acid, but we can go from 1 to 2. So we start slow, as with everything else in my practice. We start slow, we follow up with our patients, and then we increase as we go. All right. So you'll see on my screen that according to, the people that create IVs, they're saying that folic acid is pretty safe. It's very safe for babies. It's very safe for pregnancy. It's very safe for if you're lactating, for lactation. It's very safe for kids. All right. So do not be afraid of trying things. As long as you go to a clinic, you go to a practitioner that knows what she's doing, and safety is the number one concern for that practitioner, you'll always be taken care of. Now, if you are watching this in March 2024, we have a special promotion running right now, and the promotion ends March 22nd, 2024, where you can pick and choose any IVs for only $250. You can choose the prenatal, postnatal IV. You can choose the hydrogen peroxide we just discussed, the high-dose vitamin C. You can choose the antiviral, the wellness IV, the immune building IV. You can choose the energizer IV. You can choose chelation IV. You can choose the weight loss IV, the super hydration IV. Like, we have so many IVs, and each one has a special ingredient, a special formulation designed to specifically help with certain symptoms, right? If you want to lose weight, the weight loss IV is perfect. If you want to replenish and get rid of, morning sickness, or you want to have a healthy, thriving pregnancy with energy, mom can get out and exercise and walk around instead of staying in bed and feeling sick all the time. This is good. If you want to, fight viruses and bacteria, and if you want to get rid of mold exposure, if you want to get rid of heavy metal toxicity, lead, mercury, then chelation is for you. So there are so many IVs, so many tools, so many resources you have out there you can utilize that will benefit you, so that you can really get on the health and wellness wagon, right? Because we don't have time for this. Again, if you're watching this and you want to see the video version and portion of all the IVs that I just mentioned, I have videos from them, head over to our YouTube channels and you can watch the videos there. If you know anyone that can benefit from this special promotion, that has been sick, that can't shake the sickness, right? With chronic sinusitis, headaches, migraine, viral infections, bacterial infections, parasite, gut and issues, skin issues, like these is powerful. We can help. All right, just send it over our ways. If you are interested in taking part of this promotion, just you can DM me if you're watching this on the social media, or you can comment and then we'll either reach out to you, or you can call us, or you can go on our website and just reach out to us. Okay. So, but prenatal IVs, you're not getting prenatal IVs because you're afraid. They're telling you you're endangering yourself and the baby. BS. I call BS. This is really safe. Really, really safe. As long as it's preservative free, you go to a clinic that does it well, it's really, 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 really safe. All right. So I'll see you on the next video.